At 7 years old, Grace Kabuo already has scars she will live with for the rest of her life. She and other children are part of a growing number of people in Africa infected with Mpox. Few vaccine doses are available on the continent. While Grace has already recovered, others are not so lucky.
Agifatwa yamanje yaza umuriro mwinji gumaze kuza ndeba umubiri gutangiye gushanja isura gutangiye guhinduka nabi kisha mbona haje ibiheri ku maboko no kunda hose no ku rurimi rwo mu kanwa ngo ndagamba ati buno bugwayi ndono bwicara nareka mbujane kwa muganga.
The Africa CDC detected more than 38,000 Mpox cases on the continent since the start of 2022 and announced the outbreaks as a public health emergency. Soon after, the World Health Organization escalated the warnings, declaring the Mpox outbreaks a global emergency.
Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern.
The disease was originally called Monkeypox when it was discovered in the 1950s. The virus can spread easily between people and animals and causes flu-like symptoms and skin lesions. It was not known to trigger large outbreaks beyond Central and West Africa. But in May 2022, a global outbreak affected more than 70 countries. The outbreak was largely concentrated among gay and bisexual men. Vaccination efforts in wealthier countries mostly brought the disease under control after it peaked. Fewer than 1% of people who contracted the disease died during that outbreak. In November that year, the WHO renamed the virus Mpox amid concerns about racist and stigmatizing language that arose in the preceding months.
Quand je lis les témoignages des personnes qui ont pu en être infectées sur les divers médias, ça semble être une maladie qui est extrêmement douloureuse, qui pour un certain nombre de personnes peut aussi être dangereuse. Donc je pense que c'est important d'abord de se protéger, je pense que c'est important de protéger les autres et de se protéger soi aussi, surtout qu'un vaccin est disponible.
In 2024, a new variant was detected in over a dozen countries, with some East African nations reporting their first ever cases. All of those outbreaks were found to be linked to the one in Congo. Congo is currently facing outbreaks of two distinct strains of Mpox. The Africa CDC said that over 96% of all cases and deaths linked to Mpox so far this year have been from Congo. It also reported over 500 deaths elsewhere in Africa so far this year that were linked to Mpox in Congo.
Nous vivons dans l'inquiétude d'abord parce que nous ne sentons pas le gouvernement se mobiliser et se préoccuper de la meilleure manière pour essayer un peu de maîtriser cette pandémie, cette épidémie plutôt, qui essaie un peu de guetter la population congolaise.
The new variant causes milder symptoms and lesions on the genitals. That makes it harder to spot, and those who don't know they are infected could also infect others.
The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying.
Experts say work was underway to investigate the new variant's transmissibility and severity. The endemic variant in Congo is often more dangerous for children, though the risk posed to them by the new variant is still unclear.